First thing I do when I walk into the room, I'm going to do some hand hygiene. I'm just going to get my area set up. So I'm going to lift my bed to working height. Perfect. And I'm going to lift my table also to working height around waist level. So as soon as that's done, I'm going to put on some clean gloves. I'm going to do some more hand hygiene just to be safe. Take some clean gloves. Do it out of box. Perfect. Now I'm going to put a blue pad under my wound area. Just right over here. Clean. And I'm going to take my used dressing. I'm gonna look at it, inspect it, look for any weird discharge or red flags, and I'm gonna leave that for now. Palpate the area. It's all good. Okay, perfect. Now that that's done, I'm gonna take off my gloves in a mindful manner. So, and then I go from under. I'm going to remove that, throw that in my garbage. Perfect. So now I'm just gonna get my area set up. So I'm gonna remove my sterile field. It would have been open very nicely, but yeah. And I'm gonna make this into my garbage. Set that up right on the side here, and I'm going to open my flap outside, facing outwards. Now I'm gonna keep mindful of the 1-inch border. I'm gonna open up the side, open up the second side. I'm going to carefully grab my tweezers, and finally I can open up inside of myself. Perfect. Now I'm just going to set up my secondary sterile field. I'm also going to keep mindful of the 1-inch border here as well. I'm going to set this down the right way. I'm just going to grab the corner, and I'm going to grab my second corner, and I'm going to set this up right under my patient. Then I'm going to take my basin. This is our basin for today, and I'm going to set it up just right under here for later purposes. Perfect. So now I'm just going to take my tweezers, and I'm just gonna readjust my area here, and I'm just gonna see what I need. So the first thing that I need is my irrigation liquid. So because it's not brand new, I'm gonna open it. I'm gonna put some to the garbage just to sterilize it, and I'm going to pour it into my sterile field mindfully. I'm gonna close that. Perfect. Then I'm just going to open up my suture removal kit. I'm going to grab my scissors. So now the bottom part's not sterile, and I'm going to just set them down next to my scissors very carefully. Then I'm going to open this right over here, and I'm going to carefully place it over my sterile field, and I'm going to pull it on a little bit, and I'm going to place that in my liquid. And if I need any more, I would just pull it, place this carefully here, and I would just cut it right over top here. Perfect. So now I'm going to carefully place this here. I'm going to close this. I'm just going to clear my area a little bit, put some stuff away. Then I'm going to get my needle. So just carefully banana peel it open. I'm going to carefully take this over, and I'm just going to remove my needle, place it in here, put this to the side, dispose of this. I'm going to take my blunt needle, my syringe. Then I'm going to take my blunt needle, same banana peel method, and I'm going to remove this and place this in my kit, put this to the side. Perfect. So I'm going to assess to see if there's anything else I need as of right now, and Then I'm just going to take my my applicator, and I'm going to banana peel it open. Now the bottom is no longer sterile, so I'm just gonna remove it from the kit, put that here. I'm also going to take this, and I'm going to walk over to my patient. I'm going to remove the previous packing carefully. I'm going to assess it, going to look for any discharge issues. I'm going to throw this out, and I'm going to discard of this. Then I'm going to take my sheet right over here, and I'm going to just measure my wound carefully, the depth, look for tunneling and issues, the length and the width. I'm going to measure it, make sure it's all correct. I'm going to dispose of my materials. Just do some hand hygiene. Perfect. I'm going to assess if there's anything else I need before I go sterile, and the answer is no. So I'm just going to clear my area here. Then I'm going to carefully open up my sterile gloves, and I'm going to, without breaking sterility, carefully open this. Can even readjust my table a little bit. Sterile field is still not touching anything around. And I'm going to take it from the inner part. I'm gonna don very carefully my sterile gloves. So now this hand is sterile. And with this hand, I'm going to go under to maintain sterility. I'm gonna hold my glove like this. And I'm going to guide with my thumb just to make my gloves go in the proper way. And now that these hands are sterile, I could just go ahead and readjust. Perfect. So now that my hands are sterile, I can go ahead and enter my sterile field. What I'm going to do is I'm going to take my blunt needle, and I'm just going to take about 30 milliliters, the more the better, of liquid. And I'm going to add my blunt needle. I'm going to remove this area, and I'm going to walk over carefully to my patient, and I'm going to go from top to bottom in a zigzag manner. And all the irrigation is just pouring into my basin there, and just top to bottom zigzag method. And one last time, just make it nice and clean. Okay, wonderful. So now I'm just going to carefully not lean over my sterile field. I'm going to put this over top, secure it. Wonderful. So now that this is clean, we're gonna dry the wound. So I'm just gonna take some sterile gauze. I'm gonna make it into a dumpling. I'm just gonna grab my sterile tweezers. I'm gonna walk over to my patient. I'm gonna clean down the middle. That's done, and I'm going to discard of this. Just gonna go over and repeat the process for both sides. So dumpling method, grab that, and I'm gonna go from this side, and I'm going to discard. And just one more time, just to dry the wound, dumpling method, and I'm going to the other side. So did the middle first, then both sides. And I'm going to discard of this, and I can just leave this not there. It did not touch. It did not touch. Okay, so then I'm going to pack my wound because it's dry. So I'm just going to take this and squeeze the excess water out, and I'm going to use my finger, and I'm just going to wrap this around. And I'm gonna grab my second tweezers, so both are still sterile, and I'm gonna go ahead, walk over to my patient, and I'm gonna pack the wound, being mindful of not touching the abdomen and contaminating this area. So I'm gonna maybe open it up a little bit and put that over. I'm just going to come bring this back, and then I would pack the wound and I would tape it after I'm all done, and just the same process with my dirty gloves. And I'm done.